Okay, so there have been a number of N-Appeal practical demonstrations. We're just having a chat now about what you would do post-procedurally. With the more superficial or longer acting peels, such as the mandelic acid, and with all the other peels, it's important that you manage post-procedural erythema. It's important that you manage any post-procedural hyperpigmentation risks. So those are the two key things you want to look after. With darker skin types, you may be looking at using post-procedural anti-pigmentation or lightening products. With lighter skin types or Far Eastern skins, such as Sino-Asians, you again might be using anti-erythema agents. We have products, names of things like Soothe and Synchro-Rose, which contain anti-reddening agents. It is important, very important, because you are thinning the skin, that you manage post-procedural transepidermal water loss. Because you thin the skin, water will travel out of the skin a lot quicker, and you need to make sure that barrier function is controlled, and that if somebody is prone to a dry skin, you may have pre-treated them with products to boost the structure of the epidermis and the barrier function. The things you wouldn't do is you wouldn't immediately leave here, go jump in a chlorinated swimming pool, go to a sauna. If you did any exercise, whether it be a Zumba class or going to the gym or running on a treadmill, then you are much more prone to flushing because your skin is more sensitive, and hence you might find yourself going red. I wouldn't put anything on the skin other than maybe some mineral makeup or some Lycogel or Oxygenetics in terms of camouflage cream if necessary. Makeup can be worn later in the day. It's really up to the client. If you can go to the following day without makeup, that's great. You'll have a sunscreen on when you leave here, and the main thing is just to let everything calm down. Over the next 2, 3, 4, 5 days, there may be some minor flaking. There may be, it tends to kick in a bit later with an N-Appeal than it does with other peels because of the carrier system. So peeling or flaking may be at days 4 to 7 usually. If you're using the post-procedural products, then pretty much, if there is any, you'll be the only one to notice. Doesn't mean to say that some people can't peel quite a lot, but it is a lot less with N-Appeal than with comparable peels. The only other thing I'd really mention is that you've got to make sure that if you are using creams to feed the skin, make sure that the skin is intact and recovered. So if you're going to use things like growth factors or hyaluronic acid stimulators, then they can all be applied immediately after the peel, and these are a good time to apply them. But make sure that first things you're controlling is erythema, pigmentation risk, and also transepidermal water loss. Thank you for your attention. You can find other aspects of N-Appeal practicals on other videos. Thank you.